So the question posed to us was, how would we work with an individual who is experiencing delusions and hallucinations of a religious nature, either a delusion that they are God or sent to earth by God, or hallucinations of either hearing the voice of God, or hearing the devil instructing them to do certain things, what kind of approach we might take. I would first make sure that the client is exhibiting symptoms of delusions, such as that they think they're God. I would take adequate notes about the client's symptoms, along with assessing their state of mind. Cultural considerations are an aspect of this issue because many religions or religious individuals may claim to hear from God. There is a distinct difference between this cultural consideration of an individual versus the information of the criteria listed within the DSM-5 for delusions and hallucinations under schizophrenia and related disorders. Referral is definitely a part of this process. I would definitely provide a list of psychiatrists, and I say list five or six, not just one, because I remember in my undergraduate classes, as a psychology student, I remember one of my professors discussing in psychopharmacology, which is the study of medication for mental illnesses. I remember her discussing providing more than one referral, and for that, just that the client doesn't, if they don't like the referral, they most likely will not attempt to sue for inadequate care because they had a whole list. It wasn't just one. And I found that as a viable information. She was a marriage and family therapist, and she did referrals all the time to psychiatrists and to general practitioners. So secondly, I would also provide the client with a stance such as from Carl Rogers' Person-Centered Therapy, which discusses unconditional positive regard and empathy. I would also utilize therapeutic communication counseling techniques such as active listening and building rapport for the therapeutic relationship with the client. And along with person-centered therapy, there is an article that I read according to Healini, Bolton, and Fulford from 2013. Person-centered therapy may aid patients with schizophrenia with being active participants in their care and not only being passive. This approach of therapy can also provide not only insight with what's going on in the client's mind, but also insight for the client as well, but also improve the clinician-patient relationship. This therapy may also aid in self-management skills with the patient. And lastly, I would also utilize cognitive behavioral therapy along with person-centered therapy. According to Landa, Silverstein, and Swartz et al. 2016, cognitive behavioral therapy was utilized within a group setting for patients with schizophrenia. The patient's shame decreased by being able to discuss the delusions with other patients who experienced the same symptoms that they did. And this is a quote directly from the article that I'm about to say. After 13 sessions, there was a statistically significant reduction in intensity of distress with a delusion, along with an increased ability to dismiss a delusional thought. And that was from Landa, Silverstein, Swartz et al. 2006. So, thank you.